Hi, welcome to the first video of the mechanical ventilator course. Today we're going to be setting up the IPPB circuit, which stands for intermittent positive pressure breathing. This treatment is utilized for hyperinflation therapy. It can also be utilized for hyperinflation and delivery of an aerosol medication, and also can be utilized as a ventilator if need be. What we're going to be doing is setting up a generic circuit on a Bird Mark 8. A generic circuit is a circuit that is utilized or made by a manufacturer that can be utilized with multiple different machines. This circuit could be utilized with the Bennett PR2 or the Bird Mark system. So with that being said, there are extra pieces, extra hoses, extra parts in here, so you need to know what can be used or what do you need to use. Now, if you do forget, the generic circuits typically will have a diagram telling you what needs to be set up and how it needs to be done. This will be in the bags when you set them up. So when I set this up, I'm going to have the device, I'm going to have the machine, I'm going to have my circuit, I'm going to have everything that I need. The one thing that is not included in the circuit is your bacterial static, viral static filter. So I will have all that in wrapper in my patient's room. So I have now gone into my patient's room and I have performed my hand hygiene. What I'm going to do is I'm going to go ahead and take my bacterial static, viral static filter. I have taken it out of the bag and I will place it on the patient output here. This is the side that goes to the patient. This is what delivers the breath to the patient. So now to set up the circuit, or to get the circuit, I then open it up and pull it out of the bag. Be careful not to drop anything and be sure to save the bag. For when you're doing the testing and you have to cover the mouthpiece, you do not want to cover the mouthpiece with your hand. You can put it back inside the bag and utilize the bag because you need to pressure test the system when you first set it up. So I will unroll the circuit carefully and then connect it to my filter right there. If you notice, there are two lines on here. One has a huge opening and the other one does not. This brand with the large opening, we will not be utilizing that tube. So we just go ahead and get it out of here and place it to the side. Now if you notice, this tubing has a little adapter on it. If you can see here on the Mark 8, there is a little nipple here for a hose connector. There's one here and one here. We'll talk about those later. But this is the drive line that delivers the pressure for the exhalation valve and everything. But these two will not fit, so we need to take this off. Not all the machines have that nipple on there, so they put it on just in case you need it. So then that goes on just like that. Okay, so now we have this part here. Okay, I'm going to twist my tube a little bit because also in our bag there's another line which we will not need, and there's a nebulizer cup. This cup is what you utilize to deliver medication to the patient. That goes on just like that. Okay? Then also in the bag there is this hose. It's a small hose, and if you look, this will fit right on top of the nebulizer. You then take the small hose and put it on this piece right here. This is the exhalation valve. When the machine gives a breath, there is a little diaphragm in here that closes, and it closes off this exhalation valve. The gas will go into the patient, and then when they exhale, this will activate and let the gas come out. So your drive line will then go right on the nebulizer cup, and that's how it looks. The last two items in here, 6-inch piece of corrugated tubing, goes right there, and the patient's mouthpiece. Again, you don't want to use your hands, so you'll use the bag for the purposes of demonstration. so you can see I'm using my hands. The patient will put their mouth on here, and the machine will go, and we'll cover the settings and how to operate it in just a second. So to recap, you have your drive line, you have your connector to the Mark 8, you have the bacterial static, viral static filter, you have your patient circuit. This comes up to your exhalation valve. You have your medicine cup, 6-inch piece of corrugated tubing, and mouthpiece. You can also give this with a mask, like an anesthesia mask. With that, you need to be careful that the patient is cognizant and can still protect their airway. So that is it for the IPPB circuit setup. And this is a single drive line. Remember, nebulizer, cap, the line goes to the exhalation valve, drive line goes into the nebulizer.